Hi, my name is Savannah Johnson, and my topic was health impairment, so I chose epilepsy and diabetes in the classroom. So, a quick overview on epilepsy. Epilepsy is a condition in which someone has chronic seizures over time. Typically, these are categorized into two different groups. There's generalized seizures, which involve complete loss of consciousness and typically muscle contractions. It involves the entire brain. Focal partial seizures only use part of the brain, so there's part of a loss of consciousness. Typically, someone will tap themselves, smell things that aren't really there, and sometimes they can be mistaken for attention disorders like ADD or ADHD because they'll stare off into space, but really they're just having a small lapse in consciousness while they're sitting in class. And here's just a graphic. This is talking about like the electric signals that go throughout the brain. So generalized, obviously, there's more because there's using the whole part of the brain. So that involves a complete loss of consciousness. And then the focal is only part of the brain. I don't know if you could see that. That involves, partial loss of consciousness. So, epilepsy in the classroom, every student that is diagnosed by a medical professional has to have a seizure action plan put in place wherever they attend school. And the triggers for seizures can vary from anything to flashing lights. If they hadn't eaten that day, that can trigger it. Dehydration, stress. It can be a wide range of things. So, it really just depends on that particular student, what triggers them, and how you might accommodate for that. If a student does have a seizure that causes a complete loss of consciousness, you need to make sure that you don't hold them down. Don't try to hold their tongue down. You need to make sure they're flipped on their side so they don't aspirate if anything comes up. Move people out of the way. Don't crowd them. Make sure all the furniture is moved out of the way. And if you can, try to time the seizure and record any information down for the parents and for the healthcare professional afterwards. If they do happen to regain consciousness, you need to provide support there. It's always best to follow the seizure action plan. However, if the seizure does last longer than 5 minutes, it is best to contact 911. So, ways you can accommodate for that. Avoid flashy learning material. If you have video material, just try to make sure that it's not super flashy so it doesn't maybe trigger someone to have a seizure. And also, if a student's trigger is like food or drink related, make sure that they have snacks and drinks that are, approved by their healthcare provider so that you can allow them to bring those to class to avoid triggering a seizure. And then also, if they do happen to have a seizure in class, it's best to, check up on that student and make sure that they are caught up on all their material. This might be, just in the middle of class going up to them and be like, hey, did you get this? Or, hey, are you missing any of these notes? And sometimes you might need to schedule an extra tutoring session depending on how long or how extensive the seizure was. And so then I have diabetes. That's my second health impairment. Diabetes is a health condition in which there's an insulin resistance or intolerance, which makes it difficult to maintain regular blood sugar levels. These are also categorized into two different groups. There's type 1 and type 2. I have a little graphic here. So type 1 actually makes up for only 5% of the diabetic population. They're pretty much born with it. Their body just doesn't produce insulin, and there's not really a way you can reverse it. There's not any lifestyle changes that you can make in order to reverse this disease. But typically they do have some sort of pump or medication that they have to take, which differs quite a bit from type 2. Type 2 actually makes up for 95% of the diabetic population. They are not born with it. Typically this is an intolerance to insulin that is built up over time, and it can be somewhat reversed with diet, exercise, and lifestyle changes along with medication. And so, how this affects the classroom, teachers just need to be aware of the symptoms of blood sugar changes, low blood sugar in particular. Symptoms can include nausea, sweating, irritability, that sort of thing. And ways that you can accommodate for that is also make sure that they have appropriate snacks that are approved by their healthcare provider that they are allowed to bring to class. And then if a student needs to go outside of the classroom to the nurse's office for a medication, a way you can differentiate instruction is if they missed a certain part of the class, just make sure there's extensively taken notes there by a fellow student or yourself and catch them up when they get back, or maybe a tutoring session might be needed as well. Thank you guys for watching, and here's my citations.